Hello everyone, I'm Marta Montenegro. I'm the Fertility Counselor at IVFMD, and I'm happy to talk to you about a topic that we get a lot of questions, and this is about what is the perfect diet, if there's a perfect diet when doing IVF or any fertility treatment. And this is something that, of course, is kind of tricky to address, and there's a lot of information out there. And I want to give you the latest information and the latest studies on this. And we have to see this in two ways. There's studies that have done in diets related to the implantation, and there are some that have done related to egg quality. So these are two different things because not necessarily have been done in all at the same time. Most of the time has been done in either implantation or egg quality. So I'm going to bring you something really new. This is the latest studies that have been conducted on this. And so take notes and paper and pen or whatever technology you use, and I start writing down what you think is going to be the best for you. So for what the evidence has been showing for positive pregnancy or for positive results after an FAT, we have they have studied different diets, and three in particular, which I'm sure that you may have come across in your Dr. Google research. Then we have the MED diet, we have the fertility diet, and we have the pro-fertility diet. Those are the three most relevant diets that have been studied in related to implantation and diet. So to make this long story short one, just to say that they have certain things in common. The main things in common are veggie, all type of vegetable, veggies, legumes, fruits, and low animal protein. All of them advised to avoid red meat. And when addressing animal protein, either they go with fish, of course, fish low in mercury, and chicken or turkey. Those are the main animal proteins, but somehow not all of them, they don't emphasize the animal protein just to have it as, but definitely more the legumes such as beans, lentils, grains, whole grains. This doesn't mean that you need to go gluten-free or anything like that. I mean, these are oats, buckwheat, amaranth, farro, quinoa, black rice. So all of these is good. Fruits, particularly all type of berries. Veggies, as I mentioned, all type of veggies, but and they emphasize on greens, griffilines. Also, olive oil is kind of a staple in all these three diets. Again, we're talking about the MED diet, the fertility diet, and the pro-fertility diet. Where are the differences in here? The difference are more into the dairy and the poor dairy, because honestly, it's been like a crazy thing about dairy and the good, the bad about dairy. So there are some interesting, none of them advise to avoid dairy, as usually this is the most common question that I get, or I think the belief that everyone has in fertility, thinking that they need to avoid dairy, and particularly when there has been this boom of milk substitutions. And you have to be careful because not necessarily they are high in nutrients, and they could be good for the purpose of controlling your caloric intake or losing weight or managing your weight, but not necessarily for fertility. And they all advise dairy. The main issue here is if it's low fat or full fat dairy. Indeed, the fertility diet advises full fat dairy, and the other two diets, such as the pro fertility diet and the med, they advise low fat or skim dairy. And the other three things that they differ is in some advises taking particular supplements such as folic acid, of course, B12, and iron. And the bad news, alcohol. The latest study have shown in clinical pregnancy, I'm not talking about the egg retrieval, but I'm talking about pregnancy, that really you should avoid alcohol 6 months before starting any procedure. It's going to be is where it's been shown the best result. It could affect implantation and also could affect the egg retrieval in a less extent. So, but be careful because we need to avoid alcohol if you want to have that baby.